Well, it is an honor to have you here. So let me ask you something. The traditional way that we have looked at inflammatory bowel disease, and a traditional treatment involves steroids and now biologicals. But you mentioned, and you have mentioned in your work, the use of enteral nutrition. Is it a supportive treatment, or is it really something that alters the natural history of the disease?
Many units in the world, in Europe and in Australia, among other places, they use enteral nutrition as therapy for Crohn's disease, particularly in children. There are very robust data indicating the benefits of exclusive enteral nutrition in patients with Crohn's disease when these patients are treated at diagnosis. The data show that remission rates are comparable to oral prednisone, with the advantage that enteral nutritional therapy will heal the lining of the intestine, which doesn't happen with conventional prednisone therapy. So there are very good data indicating the many advantages of exclusive enteral nutrition in our patients with Crohn's disease. The data are not only in symptom relief, but also in weight gain, gains in stature, as well as gains in bone mass and in muscle mass. So exclusive enteral nutrition in one package offers many benefits to our patients.
Well, wonderful. That is fantastic. Now, let me ask you something. Are patients worried about their growth, and is that a frequent complaint for the patients and for the children that you are treating, and for the families?
Culturally, children like to grow and be no different than their peers. So there is a tremendous amount of self-perception issues in any adolescent. And adolescence is when children get struck most often by inflammatory bowel disease. So even if in a healthy child who is going through adolescence, they will look themselves in the mirror, they will measure themselves, they will compare themselves to their peers to see if they are fitting in. That is a very important part of who they are at that stage of their development. So Crohn's disease throws a monkey wrench into this because children oftentimes are shorter, their puberty is delayed, and also it offers the prospect of permanent shortage in stature. So these are very much concerns that are at the top of the agenda of families and children that come to see us in the clinic to discuss treatment options for their inflammatory bowel disease.
Is there any resistance by the families on using enteral nutrition?
There is resistance. I think that the resistance stems from the fact that the way that we currently deliver exclusive enteral nutrition means that it has to be at the exclusion of other foods by definition, and that is the way it works best. Also, the amount of additional fluid, additional things like hard candy, chewing gum, soda that kids can take, which is really part of adolescent diets, is limited or forbidden. So it really puts a tremendous amount of pressure on the child to take something that may not necessarily be palatable long term, even though the diets that we currently use are definitely more palatable than diets that we used to use a few years ago. And that stems from the fact that these diets are made up of intact protein and not pre-digested protein that always makes the flavor of the formula worse. So the prospect of taking this diet by mouth for 8 to 12 weeks is always an issue that families have to contend with. And in my experience, very motivated families and children will be successful, but if the motivation is not there, it becomes quite difficult.
Any significant side effects or problems with attempting this, other than compliance, which appears to be an issue?
So it depends a little bit on how the diet is administered. For children who take their formula by mouth, there is very little as far as side effects is concerned. Some children complain of a sensation of fullness. Some children will complain that they need to go to the bathroom more often to urinate, and in some cases, the formula will make the stools more loose. In children who receive the diet through a device such as a nasogastric tube or a gastrostomy tube, then there can be complications from the device that is used to administer the diet. But I think if done properly, those complication rates are very small, and children need follow-up in order to make sure that the device is working properly, it's in the correct position, and consequently children do well with it. In children who receive the diet at night, sometimes they need to wake up in the middle of the night to urinate because they're taking a large amount of fluid load during sleep. But compared to other therapies that have more dire side effects, then by comparison, enteral nutrition is much safer.
Thank you. Now, are physicians and clinicians, particularly in the United States, aware of the effects of enteral nutrition and the benefits of enteral nutrition in patients with Crohn's disease?
I believe that the awareness of the benefits is probably there, but the challenge is in patient acceptance and patient adherence. Now, these are not unique challenges to exclusive enteral nutrition because we know that they're there as well for other therapies. And in children in particular, it's not unusual for kids who feel well to not take their medicines. This is something that we see with other therapies as well. So it is not a unique issue with exclusive enteral nutrition, but the trouble is that without doing it properly, there is no effect on inflammation. There might be an effect on nutrition, there might be an effect on reconstitution of micronutrient defects, and there might be other benefits when it's used partially, but the effect on inflammation is severely attenuated. So it is important that families adhere, and for that reason, motivation is an extremely important factor.
Wonderful. This is fantastic information and very important for the care of these patients. On behalf of Nestle Nutrition Institute, I'm Juan Ochoa, Medical and Scientific Director for Nestle Healthcare Nutrition in the United States. I want to thank you so much, Dr. Sylvester, for being here. Appreciate it.
It is my pleasure, Dr. Ochoa.
Thank you.
Thank you.